Wonderful question, and one that I get a lot. And transitions are difficult for all of us. I think that that's one of the great challenges of being a human, is dealing with change. And as we get older, and in particular people who have dementia, those transitions or those changes in environment can be very, very difficult, and people can get superbly agitated and have a worsening of their cognition. And it reminds me, just to tell you this story, I had a patient at a local assisted living facility, and he had a small kind of bedside table where he had like a sculpture of some sort, and it was against the wall on the way to his bathroom, and had been there for quite some time without really any problems. And one day the occupational therapist came in to do therapy and decided, well, this is probably a fall hazard, which it probably was. So this is a fall hazard. And then he decided, well, I'm just gonna move it across just, like the 6 feet to the other wall and leave it there and just kind of get it out of the way. Well, this precipitated a dramatic change in this person, where he got completely lost and disoriented, and he did not recognize his room. He thought that people were coming to hurt him, that he had been kidnapped, and actually ended up eloping from the facility. And they found him outside laying on the asphalt in the parking lot. Just a small change, like taking the bed and putting it against another wall, or just making these tiny changes, can have profound implications in someone with dementia. In general, the transitions can be difficult, and yes, sometimes we have to medicate people to help them through the transition. I think that in particular, the first, I would say, 6 to 8 weeks are particularly precarious. But most people eventually do get used to their new environment. But what you're describing is actually more the rule rather than the exception. Like many times, I will get called in anticipation of a move. And then I try to make sure the person is not taking any bad medicines, get some lab work, maybe start some, medications for anxiety or some supplements, whatever it is, in anticipation of the visit. And so we try to have like a team in place before we get the person moved in, because it can be such a challenge, in particular if the person was already having some issues at home. So, but it happens a lot. In terms of using some medications to help kind of get through the hump, so to speak, yeah, we use them all the time. But the art is in which medicines and at what times to give them and what dose to use. As we get older, the body does not react to medicines the same way, and it's important to kind of try to find the smallest dose that gets the job done. But unfortunately, the story that you're telling is all too common.